there are sort of key areas. First of all, there are frequent problems with ovulation. And ovulation is, failure to ovulate is probably the commonest cause. Then the second problem really is damage to the fallopian tubes or adhesions which prevent the fallopian tubes working, either blockage, which is often the result of infection but not always, or sometimes surgical injury. And then the third reason, which is common, I mean, these aren't the only common causes, but they're the three commonest, are problems in the uterus, and they're often missed. So fibroids, for example, or congenital abnormality, adhesions inside the uterus. Now, the reason why it's really important to get a diagnosis is that more and more people now are going for in vitro fertilization, IVF, straight away. And often those causes can prevent the in vitro fertilization working. And I think there's a huge problem at the moment in IVF practice. More and more people can go to an IVF clinic and get treatment by IVF without a diagnosis being made. That's thoroughly bad medicine, but it happens constantly. And you know, if you think about it, if you went to your doctor complaining of pain in the chest and he said, well, I'm going to send you for open heart surgery, you would be appalled. You might have a bruise. You could have indigestion. You might have pneumonia. You might have bronchitis. You might have a tumor in your chest here. You might have all sorts of problems, gallbladder disease, for example, which can cause chest pain, or something wrong with your spine. So the idea that you just go for treatment, and often a very complex treatment, when a diagnosis is not being made, is absolutely bad medicine, in my view, negligent. And sadly, this is happening more and more frequently. And I think patients need to be increasingly assertive. They need to take charge of their own infertility. And that's one of the reasons for having websites like this, is to help people understand the questions they need to ask and to actually take control of what's happening to them.